Isolation procedures. It's very important for you to know the appropriate way to take care of patients who have a known or suspected source of colonization or infection. They may be placed in isolation to help prevent spreading of the germs or disease. It's necessary for you to know the appropriate respiratory hygiene or cough etiquette, and you also need to teach this to your patients. Make sure that they cover their mouth or nose. Use tissues when at all possible. If tissues are not possible, cough or sneeze into the crook of the elbow. And make sure that hand hygiene is performed afterwards. If you have a respiratory illness where you're coughing and sneezing a lot, you can wear a mask when taking care of your patients. If a patient with known disease is out in the hallway, they may be required to wear a mask to travel from unit to unit or area to area. If someone is coughing, you should sit at least 3 feet away. There are tiers for isolation protocol. Tier 1 includes standard precautions, and that's used for all clients. It includes blood, body fluids, any secretions, excretions, non-intact skin, mucous membranes. It requires the washing of the hands at appropriate times, wearing gloves, and additional personal protective equipment if you anticipate contact or splashes of body fluids. Make sure that if the personal protective equipment is damaged, that you replace it. And personal protective equipment may need to be changed when moving from a contaminated area to a clean area on the same patient. Tier 2 is transmission-based precautions. This includes your airborne precautions with known or suspected serious illnesses. These include but are not limited to measles, varicella, which is your shingles and or chickenpox, and tuberculosis. Again, you always use standard precautions. Droplet precautions will be for those clients that have suspected or known illnesses such as Haemophilus influenza type B. This also includes meningitis, pneumonia, epiglottitis, and sepsis. And invasive Neisseria meningitidis, that includes meningitis, pneumonia, and sepsis. If you look at the sign here, these signs are frequently placed on the doors of patient rooms to alert anyone going into that room the proper precautions. There are several other bacterial respiratory infections that are spread by droplet transmission: diphtheria, mycoplasma pneumonia, pertussis, plague, etc., and several viral infections such as adenovirus, influenza, mumps, parvovirus, and rubella. Contact precautions are always done. These technically are going to be your standard precautions, but they will be a little bit stricter in wearing gloves and gowns. Some of these illnesses that include contact precautions would be your gastrointestinal, respiratory, any wound infections that have MRSA, your multi-drug resistant bacterias, including or any of your enteric infections like C. diff or Clostridium difficile. RSV, or respiratory syncytial virus, your other viruses in infants and children, skin infections that are highly contagious that can occur on dry skin include diphtheria, herpes, impetigo, any cellulitis or abscesses, or pediculosis, scabies, again your zosters, which would be your like chicken pox, viral or hemorrhagic conjunctivitis, etc. So what do we do for these patients who are in these types of precautions? Airborne precautions, they have to have a private room with a negative airflow of at least 6 air exchanges per hour. You must wear a respirator or appropriate mask when you're in the room. With tuberculosis, you have to wear a respirator mask. Droplet, private room, or you can share a room with a patient who has the same bugs, so to speak. Use a mask when you're going to be closer than 3 foot. Contact precautions, private room, you can have the same type of patient in the room wearing gloves and gowns. Make sure that everyone who goes in that room knows what is required for appropriate infection control isolation procedures. There will be signs on the door. Make sure that appropriate PPE is provided for anyone who goes into the room. We try and keep equipment in the client's room if they are in isolation, which would include a thermometer, blood pressure cuff, and stethoscope, and any other equipment that might be required. Equipment that has to leave the client's room needs to be cleaned with an appropriate facility-approved germicide. Biohazard waste receptacles should be placed just inside the client's room or just outside the door. Linens should be double bagged if they might leak. Food trays should be bagged. And ancillary staff needs to be notified if a client is in isolation. They don't always know this prior to picking them up and taking them to another area of the hospital. So, how do you follow isolation protocol? At least when it requires you to put on all of the PPE. You're going to put the gown on first, covering all of your outer garments. Pull the sleeves all the way down to the wrist. Surgical mask or respirator is next. Any eyewear will be next. Clean gloves, and make sure the glove cuffs cover the gown sleeves. To take it off, the gloves will come off first. The gown will be allowed to fall from the shoulders. Do not touch the outside of the gown with your bare hands. The gown should then be rolled up into a ball with the outside on the inside. Then you take off the remainder of the PPE without touching the outside. Try and do as many client tasks when you're in the room as possible. It minimizes contamination. It also saves money by reducing the use of PPE. And make sure that the client's door is closed at all times.